GDC Mumbai, like you guys are enjoying imports Mangalore. Similarly, I was enjoying, GDC Mumbai, and being in a hostel. I would say it is like a being on cloud nine. You get the best time in the world.
Hello, everybody. A warm welcome to MediStudy Go. Today, in our interview series, we have with us Dr. Niranjan. Dr. Niranjan sir is a practicing microendodontist and microrestorative dentist from Pune. He has completed his BDS from Government Dental College, Mumbai in 2006 and from MA Raghunwala Dental College, Pune in the year 2010. From there, he is a practicing clinician as well as a teacher with a decade of experience in endodontics and adhesive dentistry. In fact, through his courses, he has mentored over 1,000 clinicians from all over the globe. He believes that dentistry has evolved over the years, much beyond the textbooks, and it is important to stay updated with new skills and techniques. He's the first in the country to conduct a rubber dam workshop, which is a 2-day extensive hands-on course, and we've been lucky to welcome him at our college, MCODS Mangalore. Thank you, sir, for accepting my invitation for this interview. I hope many students are benefited from this conversation. So, sir, we've got a lot of questions from our own students of the college and have compiled all of them to present it to you. Okay. We'll start with the most asked question, that is, how did you end up in dentistry? Was it by your choice or it was just luck?
Yeah. So the story goes back, I would say in my 90s. I still remember I was in maybe a 9th or 10th standard and I had a toothache. My mother and father, they both are doctors. Of course, they are not dentists, but my mom is an anesthesiologist. My dad is a surgeon. So apparently I had to visit one of the dentists who was, mom's good friend. And so the entire experience of undergoing a root canal treatment and a cap and pore filling, all of this was very very I would say motivating for me. And looking at the work that was happening and the front office and other aspects that are there in a particular dental clinic, it inspired me a lot. And that is the reason why I chose dentistry as my own profession. So I said that whatever be it, I am going to take BDS and I'm going to take I am going to become a dentist. So that is how my journey actually started. So since day one, though my parents are not a dentist and they are MBBS and MSMD doctors, still I had the inclination that I should pursue dentistry by profession. So this is how I landed up into doing graduation in GDC Mumbai. And eventually later on, then I pursued my master's in conservative dentistry and endodontics. That is how, my journey started.
So how was your experience at GDC Mumbai, sir?
GDC Mumbai, like you guys are enjoying imports Mangalore. Similarly, I was enjoying, GDC Mumbai. So, like maybe I'll break it up into two parts, academically and actually, personally. So academically, it was really great, and we had a lot of hands-on experience with the patients, and we were actually, examining and doing work on not less than 10 patients in a day. So there was a lot of workload. So we got a lot of hands-on experience on clinically, actually, on that. Personally, what I feel, yes, it was definitely a life-changing experience for me. There were so many things that life taught me as to, whatever difficulties come in front of you, how to tackle them, and eventually, get out of it. So personally, also, it was very great, and academically also, it was super.
That's so nice to hear, sir. So there are a lot of students who will actually be applying for BDS right now. And I personally get many DMs saying that, I want to take up BDS because I couldn't crack an MBBS seat and stuff like that. But you're a great example to show that, that's not the conventional part anymore. So what would be your advice to them? And how do you think they should set up their mindset towards dentistry?
Yes, I will, like I've been on those shoes and I know, how it feels. after doing a 12th, anybody who takes science and he's aspiring to do or to become a doctor, the first choice is always the MBBS. Okay, there are I would say, very few percentage of them who actually want to take BDS by choice. Now, what I would say on this note is that, being a dentist, maybe you won't get to use a stethoscope around the neck, but being a dentist, you have a lot of opportunities and you get to treat, I would say, one of the elite class of professionals that is there in our country or across the globe. Now, I would rather say that do not consider BDS as your second choice. Let it be one of the primary choice. Like while filling the form of the colleges, you have the first choice, you have the second choice, you have the third choice. What I would personally say that let BDS also be your first choice. So let it not be like an alternative that I didn't get an MBBS seat, so that is the reason why I'm going to pursue dentistry. No, dentistry is also going to give you the same amount of respect. It is also going to give you the same amount of experience, and your life will definitely go smooth if you follow, if you be on the right track.
Yes, sir. So since you are an academician as well as a clinician, can you share how your entire day looks like for somebody who doesn't know what dentistry is?
Like I would say that when it comes to my own clinic, I'm a bit unconventional. Normally, if you see a dental clinic timing, they start on an average somewhere around 9 or 10 o'clock. But we being a bit unconventional, we start our day at 7 o'clock. So our first appointment in the morning is at 7 a.m. Okay. So I'm an early riser, and I believe getting up early and finishing all the most important patients of the day is done in the morning time when the mind is fresh. So 7 o'clock we start, and my morning session goes almost up to 12 o'clock. 12 to 3 we have a break, and the second session, the afternoon session, starts from 3 and we wind up till 7 p.m. So on an average, if you actually see, we are open. The clinic is on an average open for 10 hours in a day, in which maybe me and my wife are working for 8 hours on an average. This is how a dental clinic actually runs. And there are a lot of patients who are actually referred by some other dentist, because me being an endodontist, I have a microscope and I have the tools and the equipments to manage complex cases. So I would say my practice is most of a referral practice. On the other note, I have patients who are dentists by their own themselves. So a dentist who wants to get their own teeth treated. So a lot of, I would say, 50% of my practice is based on those particular patients. And so we are doing all the complex cases in the morning itself. So afternoon session is like, I would say, miscellaneous work. We don't have an associate dentist. So me and my wife, Dr. Renu, she's an orthodontist. So we both manage together, both.
So yours is a very specialized practice. It's not general dentistry.
No, it's not general dentistry.
And so how do you feel to, see all the new students coming in and learning from you? And how is your experience as an academician?
So, after mentoring almost 1,000+ students, what I feel that, when at whatever stage they are, I really see myself, in a similar phase where I was at their age. So, I really feel, there is those basic skills which are there, they are somewhere lacking. So eventually that is what I want to tell each and every student, that when it comes to mastering any particular skill, you need to go till whatever way it takes and whatever you can to learn that skill and to apply it in each and every patient. This is what I feel, so after personally interacting with so many students.
Okay, sir. So how important, according to you, is to have an MBS degree? And is it possible to have, learn from courses and practice it on patients and, instead of an MDS degree, basically?
Correct. Now, this is actually a aspect which has two sides. I'll speak from both the sides. I'll speak for also and against also. Having a MDS degree, let me answer that first. So when I pursued MDS, before that, there was no right direction as to what am I going to do. When it comes to general dentistry, we are looking at all the aspects in the dental clinic. So whether it is a denture, whether it is an implant, whether it is a root canal, whether there's a filling, there are multiple aspects which we need to address when as a general dentist. But after doing MDS, I got to know that what would be my specialty, and I can particularly focus on one single aspect and master it properly. But on the other hand, I still know many general dentists who are doing, exceptional work. Their work is no less than an MDS doctor. So it is just, I would say, it's just in the mind, and it is just a degree. If you are still a general dentist, and if you feel that you want to master a particular specialty, I would say whatever it takes, the courses, the learning, attending the workshops, all of these has to be done and inculcated properly so that you master that particular skill. So whether you are an MDS doctor or whether you are a general dentist, it really does not matter. What really matters is the passion that is there within you, and till what extent can you go to learn and to master that particular skill.
Correct. So to all the people who are going to aspire to give need right now, I think that's very important tip. I mean, you can in fact be named as the rubber dam specialist of India. So what's your advice to young dentists who are really finding it difficult to use the right technique, learn the right technique? Like there is so much of material that's available, but how do you actually apply it?
Yeah. So first, let me, to now to answer this, let me share with you my experience. So 2010 was the year when I finished my masters. Okay, and almost in 2015, I was doing a mass dental practice. So I was seeing almost 10, 15 patients in a day, and patients were coming, work was happening, patients were paying, everything was going absolutely fine. In 2015, there were these two cases. In one of the case, I did a class 2 filling, where there was cotton roll placed in the buccal vestibule, lingual vestibule, and in the maxillary buccal vestibule also. Everything went very smoothly, and eventually the patient comes back after 2 months with a dislodged composite restoration that I had done on my own, and then eventually now that tooth needs a root canal. I said, boss, if I'm doing this kind of work in my own daughter's mouth or in my wife's mouth, would I like it to be ending up in this way? So that struck me really hard. That something is going wrong somewhere, and I need to find out what exactly is going wrong. So eventually, I started reading a lot about it, and I was asking my friends, my mentors who were there, and then eventually everyone said that the only answer to this is rabada. So we are moving from the amalgam era to an aesthetic dentistry era, which actually requires a lot of composites and ceramics. So whenever we are etching and bonding a surface, we practically cannot skip rabada. You know, like let's take an example. Maybe you have the best of the astringent to control any bleeding that is happening. You have the best of the suction to take care of the saliva. Then you have an excellent three-way syringe and whatnot fancy equipment. But how do we stop GCF? So GCF is nothing but gingival clavicular fluid. There is no drug or there is nothing that can actually stop that is coming out of the surface. So the only answer to this is rubber dam. And believe me, friends, whatever I'm there in front of you today, and whatever I'm there in the dental fraternity in India is all because I ventured into rubber dam. Otherwise, I would have not been here in front of you giving you this interview.
Yes, so some tips for us who are starting out.
Yeah. So what I would say that in initial years we just have to focus on knowing our passion. Okay. First, we need to know that what is the right path for me. Whether I want to venture into root canals, whether I want to venture into rubber dam, aesthetic dentistry, smile designing. FMR, you need to look out this first. So once you have that known path, whatever it takes, you need to master that particular skill so that you don't have to redo your own work. You know, so after each and every procedure is done, patients always ask, Doctor, ये कितना साल चलेगा? You need to have an answer to this. We can't be in a dicey situation, and we can't have sleepless nights. Oh, boss, there was this particular step in this procedure which I actually missed. Why did I miss? Because I was not aware of this particular step. So that should not happen. Whatever in dentistry is done with shortcuts, it will always land into trouble. So there are no shortcuts to success. We need to do whatever procedure in the right manner and to its heart. It's almost like we are doing the same procedure in my daughter's mouth or in my wife's mouth. So that kind of work has to be delivered. So to deliver that kind of work, you need to go till any extent to learn whatever you can about that particular procedure. And as it is always said, jack of all trades but master of none. So it should not be like that. You just see that what is your focus, whether you're good in surgical work or whether you're good in prosto work, whether you're good in restorative work. That passion you need to find out. Or maybe it can be non-dental also. Maybe you're good in management, you can take up MBA and do some HR job. That is also perfectly fine. Few of my batchmates, they of course they studied dentistry with me, but now they are into like one of my batchmates is a radio jockey, other is a mimicry artist, and they are doing perfectly fine. So what I would say that you just find out your own passion and you work for it and you master it. So that will take you to places. And there is no shortcut in everything. Everything has to be done in a proper manner.
So from what I've understood, that rubber dam is an integral part of the treatment when it comes to restorative dentistry and even endodontics. So how can we work unanimously in incorporating rubber dam into our practice in India?
Yeah. So when it comes to rubber dam, it is not that I've just bought the kit and we have seen some YouTube videos and I can immediately go and start practicing rubber dam. It's not that. Like for that matter, let's take an example of learning a class 1 cavity in our 3rd year undergraduate BDS. Like, we were learning how to make a class 1 cavity and filling it for almost 1 complete year. But now, how much time will you take? Maybe excavating caries and making a class 1 cavity, maybe 1 minute, max 2 minutes. That's what. So that is the amount it takes. So everything has a learning curve. So first you need to see a proper mentor or choose a proper mentor who will teach you properly. And once the particular subject has been taught, then he should be properly mentoring you for your rest of the life. So you see to that you get proper coaching about the subject, because when I learned rubber dam, there was nobody to teach me. Whatever I learned was through textbooks, through my own mistakes, and a bit from social media. Okay, so these were the only ways by which I actually learned rubber dam. So when I bought the inventory first time, there was a lot of inventory that I bought, and practically I don't use so much inventory now. It's so many things are absolutely not needed. So there are basic set of clamps, the first step, etc., which you need to know. But it is best that you choose a particular coach and you learn rubber dam from him or her.
Like which rubber dam kit do you suggest for students right now, and also for practicing clinicians who can invest in something like that?
Okay. So there are only 2 companies which are best in India. So first is the Hager Waken, and second is Colteen. If you actually ask me, among the 2, Hager Waken is definitely my first choice. Okay, because the possibilities and the flexibilities that I have with Hager Waken is enormous. Okay, so my first choice is Hager Waken. Colteen is definitely not bad. Yeah.
How much does it approximately cost to have an entire kit?
Somewhere around less than 18,000 on an average. So it can be plus and minus depending on what additional clamps you want to choose.
All right. So Can you please share some insights on how loops have helped you as a practicing clinician? And when will it be the ideal time for students to actually purchase loops?
Yeah. So this is an excellent point, Dr. Palak, what you have actually pointed out, So the second reason why I'm there in front of you is because I invested in magnification. So, in 2017, I bought my own microscope, and the world, I would say, the dental world under microscope, or rather magnification, let's generalize it, microscope and loops. The entire world, the dental world under magnification is completely different against what we see with our naked eyes. So the amount of precision that I can literally deliver is far, far, far better. So let's take an example. So composite restoration, all of us doing. Okay. So I still remember the composite restoration that I did before microscope and after microscope. So we have this habit of what we are, taking out the composite instruments from the composite syringe. We are slightly, kneading it in our fingers or on the hand, and then eventually we are carrying the same increment and placing it inside the tooth. If you see the same increment under magnification, you will see that there are so many impurities that have been incorporated into that increment. My God, I was shocked to see this. That those tiny impurities, maybe they may not cause harm in each and every case, but one odd case, sometimes might go wrong. For that matter, that the tiny microscope fibers that come out of a cloth, they also get incorporated into that tiny increment. It is so we literally get to see so much, so many things under magnification, that we can literally deliver the best what is there out of us. So as you have mentioned about loops, I would say that from day one of your practice, you should be buying your loops. Okay. Now, loops, I would say, is again a necessary inventory in your dental practice. You know, so like you have a dental chair, you have a compressor, you need a light cure. Loops is also another important inventory that you need to have. Okay. Now, loops, again, there's a learning curve to it. When you buy initially loops, you'll always get this issue that, I'm having a headache, or I'm trying, I'm straining my eyes and all this stuff. But if you're buying a loop from a standardized company, all of these things get settled in a week or so. And then eventually there would be a time where you will not work without any magnification. Like each and every procedure, whether it is a wisdom tooth extraction, whether it is a crown prep, whether it is restorative, whether it is endo, you won't do anything without tooth.
So you suggest that everybody should invest it in loops at the very beginning.
Right.
That's so nice to hear. So your company of choice to buying loops?
See, when it comes to loops, the lenses are very important. Okay. So my first choice is always Carl Zeiss. If economics is not an issue, then I would definitely say that you buy the Carl Zeiss without any doubt that how will the lenses be, etc. And now with any loops, it is important that you choose a light. Okay. So you cannot work with loops without light. You need to have a light. Okay. So my first choice is definitely Carl Zeiss. If you don't want to invest so much into it, then the next companies are Admetech and Zoomax. Okay, so these are the companies that I would recommend in case if you want to really venture into loops.
Okay. All right, sir. So, sir, there's the latest news about the increasing the duration of the undergraduate BDS course.
Right.
So, how is it going to impact the newer dentists, and what's your opinion about this entire decision?
Yeah, of course. It is, I would say, a positive change that has happened in our dentistry curriculum. This was actually long due, and it should have been happened many years ago, but never too late. That's okay. So like I was going through the article, and there were a few subjects which they are going to introduce new ones, and it will really help dentists in in getting a first-hand experience as to how to, like when a newcomer starts his own dental clinic, how should he go through the process of setting up the clinic, and how to talk to patients, and how to charge. All these aspects are getting covered into the new curriculum, definitely would help any newcomer. Yeah.
So these might be the challenges that you might have faced
Yes.
from
Yes.
college environment to actually setting up your own setup and
Setting
then
up on.
your
Yes.
own
Yes.
patients and
Yes.
that added responsibility. So how did you
Correct.
tackle it? And um what's your advice to somebody who's going to do that?
Correct. So any newcomer who is setting up a dental clinic, what I would suggest that see, now each and every locality has its own specialty. So Pune is different, Manipal is different, Mumbai is different. So any newcomer who is setting a new clinic, what I would recommend that he goes and visit a senior practitioner in and around his locality. Okay, that definitely gives a lot of insights. Like like whom to contact for the biomedical waste management, whom to contact for the which is the nearest bank, and who is the dental dealer, local dealer. All of these will definitely reduce the headache of being in an unknown territory. So handling the patients, I would say, just takes almost 30-40% of the time that we spent in a clinic. But managing it, the entire dental clinic, the HR, the admin, the patients, all of this is a huge responsibility which each and every dentist has to master over a period of time. And so getting these few insights from any local senior dentist will definitely give some idea as to how the clinic in the locality runs. And it is important that we get associated with a local dental body. Maybe it is IDA or any other private local body that is there in and around the vicinity. So these are few important things which any newcomer should definitely look out
Okay, sir. So there are a lot of students in my batch and just otherwise who are going to appear for the dentist and they're very confused about which branch they should be pursuing. So what's
for.
your advice to those young dentists? And what's the ideal time that they should know that this is a specialization that I want to pursue?
Correct, correct. Like the initial 4 years of our undergraduation, we get a fair idea of how each and every specialty works. I would say, and once we finish those 4 years of undergraduation and we venture into internship, really that is the time when one should start focusing that what would be my particular specialty. So each and everyone has their own skills. know, so we should know that which particular aspect is of dentistry would be the best for myself. Okay. Now all these specialty in the post graduation are absolutely fine. There is no specialty which is high. There is no specialty which is low, or are definitely equal. So I would leave it up to each and every oneself that what your inner voice is actually saying. That this is the specialty what I want, and each and everyone has to work around it.
Okay. So just coming back to your 22-year-old self. So if you had to give an advice to that person who has just entered the real world, what would you say?
Yeah. So I would say that patience is the most important tool that is needed when we venture out into or when we start our own dental practice. So the initial 3 years is just settling phase. So there are many things that life teaches us, and there are many things which we need to learn over a period of time. So the initial 3 years, I would say, is like a settling phase. In these 3 years, do not get disheartened that the nearby clinic has so many patients and you have just one or two patients that are walking into your dental clinic. So each and every dentist who is there in a particular locality or the vicinity has his own clientele. It will take some time for your own clientele to build up. So do not get disheartened and do not fall into shortcuts that I want to reach to the top in the initial 5 years. No, that should not be the goal in the initial years. So give it time, everything matures, everything gets ripened. It is just a matter of time. Okay. And it is very important that we be in our own dental clinic in the initial years. You don't want a patient who walks into a dental office and your receptionist telling him, "नहीं doctor तो अभी नहीं है clinic पे, वो बाद में आएंगे." Patients today, they want immediate dental treatment. So coming to your dental clinic, he wants to be addressed immediately at that particular moment. Because he has his own free time and he's come according to his convenience. Okay. So this is what we want. We want the patient to come into the dental office, and after that, it is your own personal skill how you portray yourself in front of him. So your talking skills and all these things play a very vital role in the initial few years. Maybe once you are into 30-40 years of your practice and you are an established name, it may not matter at that stage, but the initial few years, it is very important that you portray yourself in a proper manner so that the patient feels, yes, this is one doctor which I want to get treated from. Okay, so be very truthful. Do not do any shortcuts. There is no shortcut to success. Everything has to go the hard way, and everything takes time, and it will surely happen. Okay.
That's so nice. So thank you so much, sir. This is the end of my questions.